Thank you so much for electing to come here to our national headquarters today for Medicare and Medicaid services. We have an outstanding program for you today, and we think you'll enjoy every moment. I'm Pamela Gentry, the Senior Advisor for the Office of Minority Health. Once again, thank you for joining us. It's my pleasure to turn it over now to our Director of the Center for Medicaid and Medicare Services, Office of Minority Health, Dr. Cara James, who will bring you our official welcome. Dr. James.
Good morning, and thank you, Pamela, for that introduction. And thank all of you for joining us here in person and those of you who are live streaming with us today. We're very excited about the day that we have ahead of us as we take a moment to build on our past and help to shape our future with our lessons learned. And as we think about where we are and where we're going, the journey of 1,000 miles begins with a single step. And I love this quote because I think it really embodies a lot of the work that has happened, as well as where we continue to go in this very exciting time of changes within our healthcare system. And as we particularly think about and focus on today's topic of how the healthcare system is meeting the needs to help us achieve health equity for minority and other underserved populations. And as we just pause for a moment, that first step in health equity and healthcare really just started with something that one may not think of as healthcare associated, and that's the Civil Rights Act of 1964. And the reason that this is really important and critical for helping us on that first step to achieve health equity is because when Medicare and Medicaid were passed a year later, it was because of our predecessors in the Health and Education and Welfare, now precursors Office of Civil Rights, that we have health equity in Medicare as we do thus far, because they used the Title VI of the Civil Rights Act to ensure that hospitals were desegregated, that the providers who worked in those hospitals also were integrated, and that the workforce in those hospitals was diverse. And had it not been for them, the gains that we saw over the past 50 years for Medicare and Medicaid minority beneficiaries would not likely have been achieved. And we thank them for the 700 employees who went and physically inspected every single hospital to ensure that they were integrated and ready to participate in Medicare and Medicaid when it was implemented a year later. We also are going to reflect today on the report of the Secretary's Task Force for Black and White Health, also known as the Heckler Report, which really was the first federal report to document health disparities and became a stepping stone to really shed light on the challenges that minority communities face. And we think about how our programs and our beneficiaries have evolved in the 30 years since. We look at the implementation of the Children's Health Insurance Program and what that has meant to ensure that minority children are growing up to healthy adults and able to achieve and succeed in society. And then we look at the Minority Health and Disparities Research and Education Act, our first legislation really to focus on minority health and the changes that came as a result of that. The Medicare Modernization Act, also known as Part D. The Affordable Care Act, which is one of the reasons that we're here today, and the changes that have happened. And the timeline continues. Today, we're going to talk about our CMS Equity Plan for improving quality in Medicare. And to some extent, we've come full circle and back to our civil rights, where just last week, the department announced the Notice of Public Rulemaking for Section 1557 to end discrimination in our healthcare system by ensuring that we have no discrimination based on individuals' sex and sexual orientation, as well as in strengthening our provisions for those with limited English proficiency to ensure that they have equal access to our health and healthcare programs. We still have a ways to go, but there is much that we should reflect on as we move forward. And we know that with the work that has happened, it takes all of us. And one of the provisions of the Affordable Care Act was the creation and establishment of offices of minority health throughout a number of the agencies of HHS. Many of these agencies already had offices, but one of the new ones is the CMS Office of Minority Health. And we work together to ensure that across the department, as our programs and policies have grown over the past 50 years and continue to grow, that there's a spotlight being shed on the needs of our populations that we focus on within each of these agencies, because we can't do it from one central perch. But we also work together to implement the HHS Disparities Action Plan and the activities related to that, and many other things that we'll talk about. From the standpoint of today, when we think about the CMS Equity Framework, it's really kind of what guides us on our path to health equity. And it's very simple, honestly, but we call it USA. We want to increase our understanding and awareness of disparities. We want to develop and disseminate solutions, and we want to implement sustainable actions. And it's through these 3 steps that we think that we can achieve health equity for our populations. And it's this framework that's guided our agenda for today. We'll start by reflecting and kind of understanding and awareness of our disparities and where we've come, having panels to reflect on taking action and some of the solutions that we have across our stakeholders, as well as what we're doing within CMS and others to ensure equity for our populations. Again, we hope that we are on a journey, and we hope you'll join us on that journey. And as we think about where we are with our path to equity, we want to encourage you to tweet and to share your thoughts about the day, as well as what you're doing in your work to help achieve health equity. And so we encourage you to share it, #CMS Path to Equity, along with our other colleagues.